Om Swastiastu. Hello everyone, my name is Huliana Lim and I'm the representative of Student Group Discussion B8 UDAYANA Medical School. In this occasion, we will going to present our student project about hepatic cirrhosis. This is our group members and the presentation will be continued by my peer. Thank you.
Hello everyone, my name is Angelyne Mulia with last study number 051. So now I'll be presenting about the background, research questions, objectives, and benefits from the student project. First of all is the background. Hepatic cirrhosis is a chronic liver disease that refers to scarring of liver tissue due to long-term damage that leads the liver to not functioning properly. It is also called the end stage of chronic liver conditions because it appears after other stages of liver injury. Hepatic cirrhosis causes about more than 1 million deaths each year globally. Thus, it is a public health problem. About 40% of patients remain asymptomatic in long periods. Nevertheless, when the complications develop, a progressive worsening occurs with death as the outcome if the patient undergoes a liver transplant as a definitive treatment. Hepatic cirrhosis can lead to serious and life-threatening complications such as hepatic encephalopathy, gastrointestinal facial hemorrhage, ascites, hepatorenal syndrome, hepatocellular carcinoma, and spontaneous bacterial peritonitis infections. Currently, there is no improved cure for hepatic cirrhosis, and the only thing that can be done is treat the symptoms and complications to slow down its progression. However, the cost burden for hepatic cirrhosis treatment tends to be expensive depending on the cost of the disease. Next is the research questions. First, what is the definition of hepatic cirrhosis? What is the epidemiology, etiology, and risk factor of hepatic cirrhosis? How is the pathogenesis of hepatic cirrhosis? What is the clinical manifestations of hepatic cirrhosis? How to diagnose hepatic cirrhosis? How is the treatment or management available for patients with hepatic cirrhosis? What is the prognosis of hepatic cirrhosis and what complications can occur in patients with hepatic cirrhosis? And the learning objectives from these student projects are to know the definitions of hepatic cirrhosis, to understand the epidemiology, etiology, and risk factor of hepatic cirrhosis, to understand the pathogenesis of hepatic cirrhosis, to know the clinical manifestations of hepatic cirrhosis, to know how to diagnose hepatic cirrhosis, to find out the right treatment or management available for hepatic cirrhosis sufferers, to know the prognosis of hepatic cirrhosis, and to find out the complications that can occur in patients with hepatic cirrhosis. And last, for the benefits from these student projects, for medical students is to complete knowledge of hepatic cirrhosis. For scientific learning is to learn more about hepatic cirrhosis and know how to treat it. And for the community is to increasing knowledge in the community who have a better understanding of hepatic cirrhosis and the appropriate therapy for it. That's all from me. Thank you.
Hello, my name is Luh Wina Saraswati with the last 3 digits of student ID number 142. Now I will explain about the definition of hepatic cirrhosis. Hepatic cirrhosis or liver cirrhosis is defined as a late-stage state of liver fibrosis. Generally, hepatic cirrhosis is caused by several types of liver disease and conditions, such as hepatitis and chronic alcoholism. This cirrhosis appears to be scar tissue in the liver tissue caused by long-term damage that makes the function of the liver unable to function properly anymore. This stage of cirrhosis is also called the final stage of a liver disease because it appears after passing through other stage of liver injury. Hepatic cirrhosis is a severe disease where there are several main causes of alcohol abuse which can lead to alcoholic liver disease, chronic infection with hepatitis B virus and hepatitis C virus, and non-alcoholic steatohepatitis. That's all from me. The presentation will be continued by my friend. Thank you.
Good morning, Dr. Everest. My name is Felix with last digit of student ID 099. I will continue the presentation regarding epidemiology. So, cirrhosis is a leading cause of mortality and morbidity across the world. It is estimated that around 2.4% of total annual deaths is caused by cirrhosis alone. With this, the data shown by 2017. This kind of data has proven that this number will keep increasing year by year, which can be observed by the table of figure 1 in the right side of this slide. So, cirrhosis are known to cause more damage or more susceptible on male in comparison to female. In each type of cirrhosis of each type of its epidemiology or etiology. So the prevalence of cirrhosis It is known to peak at age of 4 and 50 kids and keep increasing after the age of 75. Thank you. Next.
Thank you. Hello everyone, my name is Huliana Lim. My student ID number is 2002511080. In this occasion, I will going to talk about the etiology of hepatic cirrhosis. Hepatic cirrhosis is an advanced stage of liver fibrosis that causes impairment of liver function, especially in chronic liver disease. Cirrhosis appear as an outcome of the exogenous pathogen, autoimmune, vascular process, and congenital metabolic disorder. Cirrhosis prevalence is estimated based on many factors such as geographic and age. Most common causes of cirrhosis in prosperous countries are hepatitis C virus, alcoholic liver disease, and non-alcoholic fatty liver disease. While in developing countries, the most cases are from hepatitis B virus and hepatitis C. Based on age group, major causes of the cases in children and young adults are congenital cholestasis syndrome, congenital metabolic disorder, and autoimmune disorder, while etiology in adult are hepatitis, alcohol and non-alcoholic liver disease, and of course autoimmune. Okay, I think that's it for the etiology of hepatic cirrhosis. Thank you. Next.
Hello everyone, my name is Natasya Pusparani with a 3-digit number of 227, and today I will be discussing about the risk factors of hepatic cirrhosis. There are several risk factors, but the development on cirrhosis can happen with or without them. So these risk factors would only increase the chances of developing cirrhosis. The first risk factor is excessive alcohol consumption. High amounts of alcohol intake over long periods of time can become toxic to liver cells. It can damage the liver by altering one's body to process food. The second risk factor is medical conditions, which include chronic infection with hepatitis B or hepatitis C and non-alcoholic fatty liver disease or NAFLD. For the chronic infections, it usually leads to liver inflammation and injury, so over time it may progress into cirrhosis. As for NAFLD, there would be a buildup on lipid cells, which would lead to scarring over time. This is usually associated with pre-existing conditions such as diabetes, obesity, high triglyceride levels in the blood, coronary artery disease, and others.
My name is Gede Raka Samudra, number 023. Now I will explain you about the pathogenesis. Fibrosis is started by stellate cells and Kupffer cells activation, injured hepatocytes, and stimulated platelets. Stellate cells activation involves not only several cytokines and their receptors, but also ROI, or reactive oxygen intermediates, and autocrine paracrine signals. In the initial stage of activation, the enlarged stellate cells lose immunomodulator or retinoids with coactivator of receptors for fibrogenic and bursting cytokines like TGF-B1 or transforming growth factor beta-1 as a dominant fibrogenic mediator, and PDGF or platelet-derived growth factor. Inflammatory cells generate fibrosis caused by cytokine secretion. Subendothelial fibrosis develops endothelial function deficiency and weakens liver function. That's all from me. Thank you.
Hello everybody, in this opportunity I want to explain the clinical manifestations of hepatic cirrhosis. Before it, let me introduce myself. My name is Putu Artika and my student identification number is 20025111084. Okay, so let's start it. Most patients with compensated cirrhosis remain asymptomatic. When symptoms occur, they include fatigue, weakness, loss of appetite, right upper quadrant discomfort, and unexplained weight loss. With the onset of decompensation, patients may report symptoms of impaired liver function, such as jaundice, portal hypertension, including ascites, facial bleeding, and peripheral edema. And then hepatic encephalopathy because of decreased detoxification capabilities of the liver, such as confusion and disordered sleep, and coagulopathy because of decreased hepatic synthetic function, including incibrating. In early compensated disease, laboratory finding may be normal. Findings suggestive of cirrhosis include low albumin, thrombocytopenia, the ratio of aspartate transaminase per alanine transaminase greater than 1, elevated bilirubin, and a prolonged prothrombin time. Okay, that's all the clinical manifestation of hepatic cirrhosis. The presentation will be continued with my friends. Thank you.
Hello everyone, my name is Bagus Ugrasena with my number is 20251184. So today we talk about a diagnosis. So to diagnose a cirrhosis, there are some many methods can be used actually, especially a laboratory examinations. Now, however, the gold standard in this diagnosis of cirrhosis is still a liver biopsy. Cirrhosis is characterized by a fibrous septal between a portal vein. On laboratory examinations, there are several points that must be considered in the diagnosis of cirrhosis. So, namely, an increase in liver enzyme, increasingly in bilirubin, and increasingly in the international normalized ratio, or we call it INR, ENR. So, liver enzyme included an aspirate transminase and also alanine transminase, or ALT, and others, etc. So the thrombocytopenia is also found in almost all the cirrhosis patients. So almost that enzyme, and also there's a found a thrombocytopenia. Now, laboratory tests that can be used but are not recommended because there's no certainty of value that these laboratory tests can be used to diagnose cirrhosis for the screening for cirrhosis also. So there's cirrhosis. There's no laboratory examination that's recommended for this diagnosis. So thank you. Next.
Hello, my name is Azza Alfadhil with 3-digit student ID number 094. I will explain about the treatment for hepatic cirrhosis. The goal for treatment itself is to reduce symptoms and prevent more complications. The first one is lifestyle change. It is necessary to provide counseling about lifestyle change, including avoiding alcohol, quitting smoking, providing nutrition and balanced diet, losing weight, and giving vaccination, such as HPV and HCV. The specific therapies for hepatic cirrhosis will depend on the cause of liver damage. For example, giving antiviral in viral hepatitis or immunosuppression agents in autoimmune hepatitis. Other medication may be needed to relieve symptoms, such as diuretics to reduce fluid that cause edema, also deoxycholic acid and beta blockers such as propranolol to treat portal hypertension. In severe case of liver cirrhosis, when the liver is no longer functioning, liver transplant is the only treatment option. Liver transplant itself is a major surgical procedure to replace patient liver with donor liver. That's all from me. Next.
Hello everyone, my name is Gloria Grace with last 3-digit number 162, and I'm going to explain the prognosis of hepatic cirrhosis. So the patients that suffer compensated cirrhosis have a median survival time of more than 12 years, and it is asymptomatic. Models to predict survival in compensated cirrhosis is child-pug classification, while decompensated cirrhosis, marked by the presence or development of complication, has a median survival time of approximately 2 years, and the tools to predict the survival rate is MELD score. To determine predicting prognosis, the assessment that has to be taken are renal dysfunction, infections, and hyponatremia. A patient who suffers decompensated cirrhosis with complication has a mortality rate increase of 7.6 times, while a patient that develops an infection has a mortality rate increase of 3.75 times. Hyponatremia contributes to complication and mortality escalation. That's all from me for the prognosis of hepatic cirrhosis. The next slide will be presented by my friend. Thank you.
Thank you for the opportunity. My name is Krishna Putra Pramanda with the number 128. So now I would like to continue the presentation about the complication. There are so many complications due to hepatic cirrhosis. The first one is portal hypertension. Cirrhosis reduces the circulation of the blood through the liver, thus raising pressure in the vein that carries blood from the intestine and spleen to the liver. Additionally to that, swelling and alteration to the spleen or splenomegaly, as well as enlargement of white blood cells and platelets, are all possible side effects of portal hypertension. Other complications are ascites, swelling and fluid in the belly and lower body induced by splenic artery vasodilation due to elevated blood pressure in the liver, blood flow, or portal hypertension. Hepatic encephalopathy is also a complication of hepatic cirrhosis. Cirrhosis damages the liver, which makes it unable to remove toxin from the blood. When it happens, it causes loss of brain function, and cirrhosis with chronic irreversible illness can cause scar tissue and increase the risk of liver cancer in a patient due to malignant declination. I think that's all from me. This presentation will be continued by my friend. Thank you.
Good afternoon, Doctor. I'm Annisa Nuraini with the last three digits of NIM 110. I would like to continue the last part of the presentation, which is conclusion. Cirrhosis is defined as a late stage of liver fibrosis. Universally, male are more susceptible to cirrhosis compared to females, with higher male cases in each type of cirrhosis. Risk factors of hepatic cirrhosis include excessive alcohol consumption and pre-existing conditions like chronic infection with hepatitis B or C and NAFLD. The clinical manifestation of cirrhosis involves reproducing lesions and normal globular structure destruction within the lesions that causes reduced bloodstream throughout the liver. The majority of people with compensated cirrhosis are asymptomatic. Patients may have signs of jaundice, portal hypertension, and hepatic encephalopathy. Although lab examination can be used to diagnose cirrhosis, the gold standard remains a liver biopsy. Treatment consists of lifestyle changes, vaccinations, and monitoring to reduce symptoms and prevent complications. In severe cases, liver transplant can be done. To predict prognosis, assessment of renal dysfunction, infections, and hyponatremia are necessary. Complications of hepatic cirrhosis include portal hypertension, splenomegaly, and hepatic encephalopathy.
Thank you, Annisa, for the conclusion. And this is our references that we used in our student project. Okay, I think this is the end of our presentation. Thank you for all your attention, and sorry if we had many mistakes. Thank you, and Om Santi 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 Om. Goodbye, everyone. Thank you.